Now, in some states, such as Punjab, Assam, HIV transmission, the maximum route of transmission is through the injecting drug community, IDU. But in our state, it's through the sexual route, unsafe sex, through the sexual route. So precisely, it's about 87% of transmission is through the sexual route. Whereas the in the transmission through the injecting drug use is limited, I would say, to something like 8.6%. So again, I would also like to apprise you of the fact that unlike most of the Northeast states, the trend of HIV transmission is, I would say, more or less stabilized in our state. So to give you data on this, starting from 2020, back then we had a prevalence rate of 1.39. Today, our prevalence rate is, we stand at 1.37. So we, especially the Nagaland State AIDS Control Society, draws inspiration from these figures. So actually, based a formal study also shows that our population, more than 90% of our population has some degree of knowledge. At a point of time or the other, they have been made aware, especially on the routes of transmission of HIV. However, the 90+% has not really translated into safe behaviors. So Nagaland today stands at number 2 in as much as the prevalence rate is concerned. The number 1 state is Mizoram, followed by Nagaland state, and therefore the importance of awareness activities cannot be overemphasized here. So, coming back to our intensive IEC program tomorrow, it's formally to be launched tomorrow at 11 o'clock, following which activities will start. Similar activities will start in all the districts. And like last year, we look forward and we intend to reach out to all nooks and corners. So therefore, we have targeted altogether 520 villages. 520 villages, 376 schools, 110 colleges, and so forth. So our activities will be, yes, awareness activities, and we will also be having some special activities in the form of flash mobs, in the form of folk performances. So precisely again, folk performances, we will be staging about 100 folk performances with about 50 flash dances. And precisely, our target is for about 5,200 door-to-door campaigns, household visits, which maybe at the end of the day, we look forward to achieving more than our target also. So again, I solicit the full cooperation of our media friends, like in the past, because it is, as we all know, the creation of HIV awareness, the best route is through our media, and therefore we have called for this press meet with you all today, and looking forward to your extended support in the days to come, starting from tomorrow. Thank you very much. So now, any questions, any clarifications? You're welcome.
Sir, regarding tomorrow's program, how many participants are expected, and from which departments or from which part of the society are they invited?
Yes. Again, precisely, we are targeting, of course, we are targeting the general population, but in as much as tomorrow's program is concerned, we are expecting participation of more than 3,500 students from schools and colleges.
Tomorrow is also International Day. It's 12 August.
So this is a national event. So it will be pan India, happening on the same day. Yes, campaign starts tomorrow, kicks off tomorrow, 12th of August. It will go on for 2 months till the 12th of October.
Where is the launching point of the national campaign starting from tomorrow? At the moment, under National AIDS Control Organization, we have 36 state control societies. So across the country, the launching will happen at state level. NACO and regions that through this campaign we will reach the maximum number of population, maximum number of ages. Last year was the first edition of the campaign from 12 August to 12 October. This year is the second edition. Last year, Pan India, we were able to reach 1,24,257 villages, out of which, as per your press note, Nagaland contributed 789 villages. So this year, we are trying to cover the uncovered villages of last year. So 520 is what we're targeting this year, villages, where village level meetings will happen, school outreach will happen, in that school, a door-to-door campaign in that village will happen. So implementing what Sir has said, we will also be having some special camps in government hospitals for testing drive, and another activity these are already covered for performances and flash mob activity which will be carried out by red and brown activities in 17 districts.
And then another 5% through an infected parent to child, parents who are not on treatment. If parents are on treatment, then infection to the child is also detected. So that is, those are some of our concerns which needs a collective response, because it's not only to the targeted, we cannot say it's a targeted or marginalized populations that getting the infection, no, because the epidemic is very generalized. At the same time, the sexual route of transmission, unprotected sexual route of transmission is very high. So that's where we all need to come together and make sure that everyone understands the route of transmission and get themselves tested as well.
Indicator is to have no new infections by 2030. As per NACO's data, Nagaland has achieved 37% decrease in new HIV infections since 2010. So somehow the prevalence rate may be not very static, or may not be dropping down so much. But one of our main concerns is also to stop new HIV infections. For those who are living in HIV, treatment, promotion of treatment and services that are provided by the government through our hospitals are promoted, but one of the main objectives is also to reduce new HIV infections. We have achieved around 37% increase in new infections since 2010. So that is also one thing that we are looking at, so that the reduction is not just 37%, but by the end of by 2030 or by after 5 years, at least the reduction of new infections come down drastically. That is something that we looking at. And that is why we are intensifying a lot of our campaigns targeted towards the youth.
To cater to the patients suffering from this disease?
We have 13 centers in all the districts except the new districts. And what was the other question?
Like, is there enough to suffice the patients?
For now, district-wise, it is enough for now. We have not increased, but we have not asked for increasing the number.
And based on the need of the, for example, the PNHIV population of a certain district, when there is a need to enhance the services, we have something called the LEC, Linked ART Center, through which we facilitate the treatment, the ART.
So these are the, we don't open new centers, but the existing health centers like CHC or hospital or even HC can cater to dispensing medicines, treatment medications. So we're not opening new centers, but we're linking to the existing services.
Okay,
And another thing which I would like to apprise you of is on the lines of what our JD IEC had mentioned. Based on the SDG goals, and under the aegis of NACO, National AIDS Control Organization, the Nagaland NSACS is also working towards achievement of the 395s. The 395s are, the first 95 has to do with all HIV infected people in the society are to know their status. To know their status as in whether they are HIV positive or negative. So that first 95 target, that first 95 population of people knowing the status are to be brought under ART treatment and pre-retroviral therapy. So at least 95% of that population are brought under treatment. And the third 95 goal is, having brought this 95 under treatment, the goal is for them to achieve the viral suppressed status, where the virus is no longer visible in their blood during investigation. So there is something called U equals U. So when the virus is no longer detectable in your blood, meaning you will no longer transmit the virus to your sexual partner or your injecting needle sharing partner, and so on and so forth. So the 395s is what we are working on.
Just on village areas.
Yes, they are. If you just compare, not with data, but if you see the kind of campaigns that we've been carrying since the past 10 years, even say, for example, Hornbill Festival. 10 years ago, we used to really try to motivate people to come for testing in Hornbill Festival area. Last year, we've seen that, without us motivating also, visitors who are walking into Hornbill Festival itself are pulling each other to come forward for testing. So that also shows that somehow the stigma and discrimination is also reducing to a certain extent. In the villages also, we are mobile vans. We have 12 mobile vans in 12 districts. They carry out outreach activities whole year round, because they've already planned route from the first month onwards. So the kind of testing that is coming forward through these vans, because these vans and bikes also are meant to reach hard to reach areas where people cannot come to the hospitals. So the service is taken to the doorstep. So the kind of testing, people coming forward for testing is also increasing. Last year and two years back, we've had folk performances in 6 priority districts through one agency. They were called not Dreams Unlimited, but Busy Entertainment. Yeah. So the aim was to sort of engage people through folk performance, through skit plays on HIV, and then side by side give counseling and testing services also. So a huge number have turned out this